when the pandemic broke up in China, the question was it really going to come to Africa or come to Nigeria because of our weather and all the stuff? But of course, we just knew that it was just a matter of time. April 25th, we got the first case in Owerri. And of course, the FFC Isolation Ward was the only operational isolation center in the state then. So on the average, I think we've managed close to 1,200 patients.
Once there is an outbreak, if it happens in a ward or local government, you have the people that work with the primary health that you need to report to. Maybe the health sister or the officer in charge of the facility will put a call across to the epidemiologist, who will now escalate it to the state level.
Deriving from the national policy from NCDC, issue of having to ensure that every state of the country has a physical space that is called the EOC for epidemic control coordination. Imo State some time ago did not have one, but since 2020, precisely sometime in July, our own got set up. Since then has been running. That is the hallmark really of epidemic preparedness in our state and coordination.
One basic principle we have that have worked for us is strengthening already existing health systems. We have trained and retrained health frontline workers to make sure that they are ready for cases of epidemics and pandemics. We are also putting a whole lot to risk communication. So we are sensitizing people, telling them about symptoms and preventive measures.
I think it's a good process, it's a good thing to start, because you don't wait for a problem before you can begin to think about how to solve it. So if we start talking about it even before there is an epidemic, I think it will help us to be ready.
It's a good one, and it can only help us to grow, because naturally evaluation cannot be by itself. Monitoring can happen by itself, but evaluation must be by an external, which we know. So it's one of the programmatic processes for proper project implementation and reprogramming.
It will be good, because once you do all those evaluations, you tend to know your weaknesses. Because infectious diseases, epidemics are usually, they are just on their way. The next one will come. So if the state can adapt it, we'll know where our shortcomings are and work towards building it. So the next case that will come won't cause us unawares.